Welcome to the Shaping Portsmouth podcast. Shaping Portsmouth is a collaboration of key Portsmouth businesses, transforming Portsmouth together.
Okay, so welcome to this week's edition of the Shaping Portsmouth podcast. I'm here with Trevor Payne. Hello, Trevor.
Hello.
Thank you for joining us. Would you like to just introduce yourself and say a little bit about your business and what you do?
Yes, I'll say my name's Trevor Payne. I'm an orthopaedic clinician. So I have a small clinic based here in the John Pound Centre in Portsea, where I specialise in complex knee cases. So anybody that's had knee reconstruction, knee replacement, or any ligament issue, whether they be an athlete or member of the general population, I can use 30 years of experience getting them, back to health, getting them back to, being the athlete that they are, or getting up off the sofa to chase grandchildren.
Yeah.
Anything to do with the knee or the lower limb, so predominantly the knee, is what I focus on and specialise in.
Okay. That I love about this city. There are so many people doing so many amazing things, and it's a great joy actually to invite people onto this podcast to kind of learn more about what you get up to and what inspired you, really. I remember we crossed paths when Clare Martin was doing her Pompey Plod.
Yep.
I know that you're friends with Clare, aren't you?
I've known Clare for far too many years.
Okay.
We will never admit to how many.
Okay.
Because we're both 21.
Are you sure?
I think I actually started her running. I'll take her out for runs when she would look at me and swear and say, I'm not coming. But I would drag her out, and now she's off running, doing marathons, half marathons. She was in Belgium a couple of months ago.
Wow.
She then did the 5 marathons in 5 days.
It was so impressive, wasn't it?
Yeah.
What an achievement.
Yeah, no, I went to her house and we had a chat about nutrition and how to pace herself over 5 days. And then I was texting her throughout the 5 days. She did amazingly, because I just said, try this, try that, do this, do that. But she put her shoes on every morning. Yeah. And got out the front door and did it.
And sometimes with those kind of challenges, I'm sure it's as much about your mind as well as your body, really, to get up and to keep going every day.
Yeah, no, it is. I mean, I used to be something of an athlete. I was a long course triathlete. Okay. And again, it's all mental.
Yeah.
When your body just wants to curl up in bed, but you know that you've got to get out of bed at 5 o'clock in the morning to go for a swim or to go for a long bike ride, when the body's saying one thing, but you've got to get out and do it. So it is 90% mental. Like people that I deal with in clinic, we know lower limb injuries affect the mind more than upper body.
Okay.
Issues.
Why is that, Trevor?
Because to get out of a chair or into a chair, onto the toilet, in and out of a bath, you name it, to walk, to climb upstairs. I mean, we're here now on the 3rd floor.
Sure.
So, if you've got somebody with a lower limb issue, walking upstairs is going to be, a bit of a pain for them.
And so I guess it's more limiting.
Yeah, it is.
If you have an injury.
Yes, and this is what I'm trying to do within Portsmouth. And I'm not going to go into my usual soapbox rant of the NHS and how they're struggling. But like I say, when you've got somebody with a knee issue, with an Achilles tendinopathy, and they can't do what they used to be able to do, there is a spiral which we all know. Obviously, you go from chasing the grandchildren around the park playing football with them, injuring yourself, sitting on the sofa, watching daytime TV, putting on weight, fearing movement, which is called kinesiophobia, one of my favourite words.
Right.
And then you get, diabetes and all the rest of it.
And your mental well-being.
And your mental well-being.
Declines,
I'm saying kinesiophobia, it's fear of re-injuring yourself through movement. So if you've fallen over and damaged your knee, then obviously you're always going to be thinking, oh, if I fall over again, then, you know, what is that going to do? So, yeah, you sit on your sofa and watch Lorraine Kelly or whatever her name is, and it is a downward spiral. So what I'm trying to do is get in and educate, you know, people right at the beginning.
Okay. And what kind of ways do you do that, Trevor? What do you do at your clinic in John Pounds?
It's 50-50 of, like I say, educating people, on what's right and what's wrong, because there's still stuff out there, on the internet, in newspapers, in magazines, that's outdated. I mean, like I say, when I did a chat with the ladies at Spark, we were talking about the acronym RICE.
Yeah, and we had a similar chat, didn't we? Because that's something that I learnt when I was at school. So, and it was news to me. That's outdated now. Is that right?
Yes, yeah. Dr. Gabe Merkin, who came up with the acronym in 1978.
And remind us what RICE stands for.
Rest, ice, compression, elevation.
Okay, and that's when you have some kind of knee injury
an acute,
or
it
okay.
doesn't have to be a knee. I mean, any sort of acute injury. So yeah, an elbow, a knee, an ankle, a hamstring, a calf, lower back. Then we were always told to put like the frozen bag of peas on your knee or wherever. But we know that resting and ice actually slows the healing down.
Okay.
Compression and elevation are still used.
Right.
And like I say, we've gone from RICE to police to other various. We're now at peace and love.
Okay. And what does peace and love mean in this context?
Protect, elevate.
Okay.
Avoid anti-inflammatories.
Right.
So again, like I say, you become injured, or like I say, you sprain your ankle, and then you just go straight for the ibuprofen. But the body actually heals itself from within.
Okay.
So inflammation is actually good. So to take a ibuprofen tablet, or anything like that, you're actually doing, harm is a strong word, but you're not actually helping yourself. So yeah, protect, elevate, avoid anti-inflammatories, compression, educate, which again is kind of where some of my services come in, because I can talk to people, educate them. Again, a very good doctor, a pioneer surgeon in the 60s, Dr. Edward DeBakey, came up with this tagline: good information is the best medicine.
Right.
So yeah, obviously, it's, with anything, the better educated, the better informed you are.
Yeah.
The better your service or the way that you deal with something, anything, is going to be. So.
And I guess when you have an injury, how you treat it at that stage, after it's happened, is quite crucial, isn't it? Into how you heal and the habits you probably form whilst you have an injury.
Yes, yeah. I mean, I was saying the first 24, 48 hours are kind of key. So, I mean, I was dealing with a young female a couple of weeks ago who sprained her ankle. She's a rock climber. Okay. So she was over Whiteley. They've got a climbing centre over there. Yeah. She came down, sprained her ankle. And I said, okay, well, you're 13 years of age, so yeah, spend the next 24 hours sitting on the sofa eating ice cream. After that, you're going to get up and you're actually going to put some weight on the ankle. You're going to gently start to load it. And again, she was like, oh, I can't do it, it hurts. I said, yeah, it's graded exposure. Okay. So I'm not saying, get off the sofa and start,
go for a run.
Go for a run and stuff. Yeah. But gently start putting a little bit of load, because ligaments and tendons actually like load, which is where, with the RICE, the first thing is rest. Rest is the worst thing you can do. Okay. You need the body, like I say, ligaments, tendons, they actually like to be loaded. They need that going through the system. So yeah, to sit there watching, TV. Sure. It is not the best thing for you. So yeah, RICE is out. I mean,
okay, and so we've got peace, and where does the love come into it? I'm testing your knowledge today.
You are. Load, optimism.
Okay.
vascularization, so again, blood flow,
Okay.
and then exercise.
Right.
Wow, I actually remembered that
I
at
know,
this time
well
in the morning.
done.
Yeah.
And I really love that within that peace and love, there are some things like for your mind also. Like it's
Yep.
not just about how you're treating your body and the injury, like the optimism part. It's like, believe, I guess, that you're going to be okay and that you can get up and get out and avoid
Exactly.
that kind of the fear of movement that you were talking about.
Yes, yes. So when I say people come and see me, and the way I work, I don't like to see people, for like too many sessions.
Mm-hmm.
I don't say, okay, you're going to book in now for 6 or 10 sessions.
Mm-hmm.
Because over 30 years, I know that I'll see you for a session. We work out an exercise plan. You then got to go back home, go to your gym or wherever it is that you train or exercise.
Mm-hmm.
And it's going to take 2 or 3 weeks for that exercise plan to actually start to have an effect on the body.
Yeah,
So rather than, kind of just grabbing your money,
sure.
I don't work, like I say, I educate you, I hopefully instill optimism in you. Because I always say to people that, you have my phone number, you have my email address, you can find me on social media,
Mm-hmm.
just message me.
Yeah.
And I'll be there as long as it's not too late in the evening.
Mm-hmm.
Then just message me and I'll be there for you. But I'll then see you in 3 weeks or 4 weeks when we know that the body will have actually adjusted to that rehab plan. And then again, we see you. I see you.
Mm-hmm.
And then again, we tweak it as and when needed. So again, it's about a 6 month thing. But
Sure.
within 6 months, I see you 4 to 6 times. It's
Sure.
not, for an hour, so that's 6 hours of me.
And I guess the work is happening in between the sessions, isn't it? That's where the real work is happening. So in all the people that come and visit you or that you work with, what are the most common kind of, I don't want to say what conditions or what's the right terminology? What
I'm not a big one for labels, so I normally just say issue or
yes,
condition.
Yes. What are the most common ones, I guess? And do you have any kind of wisdom you can share with us on ways to avoid them?
The most common issues I see, I work with 2 prominent surgeons, one based in London, one based in Southampton.
Mm-hmm.
So again, they'll send me, people that they've, reconstructed a knee for or grafted a new ACL ligament. So a lot of my work is done that way through, focusing on knee reconstruction, ACL rehab. But then, I see people that have got tendinopathies, whether it be a patella tendon or some other sort of ligament. I mean, so when if they've got a ligament issue via sport or from falling over, then it is more about adapting your active daily living, so how you're getting around your home. I mean, again, I'm working with I want to say she's 85 years of age. 84, somewhere. And she had a fall. So again, it's about putting things in place in her home so that she doesn't
do that again. Yeah.
And again, a lot of it, as we've said, is the mental side of things. So me with my PhD in verbal diarrhea, sorry listeners, then I will just educate them and explain to them that it is okay to move. You don't have to fear movement. So again, it's about putting things in place. And even though I'm a one-man band, I do have a lot of people behind me. Nutritionists, psychiatrists, psychologists, GPs. So if I can't help, then I send them to another specialist, and we all help that one individual. So again, a lot of exercise is brilliant. So I mean, all I would say to people is to go and exercise. Again, for cardiovascular health, for chronic artery disease, for even dementia and Alzheimer's, and some cancers. We know that exercise does actually help. So again, And to kind of answer your question, again, it's about me just saying, yes, you've got this going on, this issue, whether it be, knee or some... Nobody dies of an MSK, a musculoskeletal issue. We die from the comorbidities that come with that. So again, that's sitting down, putting on weight, getting diabetes, rheumatoid arthritis. So
it's like the catalyst to other things. Yeah.
So again, it's ways I can help is kind of coming in doing this podcast. I think when we spoke last time, you said about coming in and doing some talks over at the Guildhall, or like I say with Spark. I did some stuff with them, with Sandy. Wonderful
just
woman.
sharing the kind of message and okay. That makes complete sense.
But what we all can do, and I'm being a major hypocrite here because I used to be an athlete and I haven't done much in 12 months.
Okay.
Life stuff and work and all the rest of it. But it's to go out and have a walk.
Yeah. Walking is so good for you. Like it's like a body and mind thing. I think if you just make that space to like go somewhere in nature, you not be looking at your phone, you're not answering emails, you're just a bit more present in that moment. And I guess there's always this kind of debate about whether running is good for you in terms of your knees, I suppose. It
is very, very good for you.
Yeah.
And I have my mum's voice in my head at the moment.
Yeah.
Because she always says, oh no, running's not good for your knees.
Yeah.
Again, I could bore you with the research, but I won't. But running is actually good for your knees.
Okay.
To us, there's always a bell curve to most things. But for recreational running, if you're a recreational runner, running, running actually helps with arthritis.
Okay.
Once the training load and the demand on the knees gets too great, so again, your professional, runners, your marathon runners, your triathletes, then they kind of know that they are going to get some sort of arthritis down the line when they stop. So I get people coming into me and say, oh, I used to run, but my knees hurt now, so I've stopped running. But you'll just get grumpy Trevors that come and say, well, go and put your training shoes on and go out for a run then.
Yeah,
because it is actually good for you. And again, we've got all the research. In this day and age, there is so much information out there.
Yeah. But it can get quite confusing because I've read so many things that say, walking is better than running, for example. So it's good to hear you share your thoughts on that.
Walking is good. The whole 10,000 steps is anywhere between 6 and 10,000. So you don't have to. When it came out, you've got to walk 10,000 steps. Everybody was like, oh, I've got to walk 10,000 steps. I think, anywhere between 6 and 10,000.
Okay, well, that's good to know.
Because again, if you're... here in Portsmouth, where it's flat, then 10,000 steps. But if you're somewhere where it's a little bit more undulating, and you're going to get, let's say those, I'll use the word hill, but let's say those inclines and declines, then so again, your heart rate's going to be going up and down as you're climbing and descending and all the rest of it. So 6,000 steps is plenty.
Okay. Well, that's good to know because sometimes you feel the pressure to get to 10,000. And if you don't get to 10,000, you're like, oh no, I've failed today. Yeah. I haven't quite got there.
And again, the research on the 10,000 steps comes from the armed forces.
Okay.
So it was actually measuring and monitoring, people going through basic training in the army and in the Navy. Well, I could look out the window and see just members of the general public that haven't got anything to do with the armed forces. So again, it's first of all look to where the research has come from.
Yes, okay.
And then tailor it to your own needs, wants, demands, expectations.
Yeah,
all the rest
and
of
I
it.
guess don't be so hard on yourself if you don't quite get there. You've done, what you can in your day, then that's and what feels right for you. And some days you do more, don't you?
Yes.
I was just thinking actually, Trevor, because we have loads of brilliant businesses in our network. We have loads of charities, and I often see our business community taking on these challenges to help raise funds and support charities. Great Self Run is one of them. I know there's teams that are formed to to run the Great South Run, what Claire did, her Pompey Plod. So I see these kind of like business people taking on these challenges, and perhaps they have run or perhaps they're new to running. And I just wondered do you have any advice, or what's the best way someone can go from maybe a non-runner to taking on the Great South Run? Like, what does it look like to keep themselves and their knees and feeling well?
I think first of all, like I say, if you just remember that running is actually good for your knees. And I don't know, at the end of this or today, tomorrow, I can actually send you all the research so you can put it out there. Because again, there's information overload, and I will sit in my clinic or at home and I read 2-3 medical journals a day or papers a day. Yes, well, I'm really boring.
Well, I guess, like you say, there's so much information. It's so important for you to keep up to date with what's actually happening and the facts of it.
So like I say, just know that it is actually going to be good for you in so many things. Like I say, weight control, like I say, your nutritional side. Because once you start running or riding a bike, you then do start to pay more attention to, what you're eating.
Yeah. It all kind of links into each other, doesn't it?
And again, in terms of like the running, I mean, the Couch to 5K.
Yeah.
Get the app on your phone. Start with something as basic and as simple as that.
Yeah.
And then hopefully you'll find as the weather improves, they're saying that it's icy. Well, it's not icy, it's cold out there. We've had summer last week. But like I say, put your shoes on.
Take it slow.
Go and walk for a bit, run for a bit, do the whole lamppost thing.
Yeah, okay.
Run a couple of lampposts, walk a couple of lampposts, run a couple, and just build up by doing that. Get yourself out to the countryside. I mean, we've got the South Downs on our doorstep. Pretty much go up over Portsdown Hill.
Yeah.
And you've got some beautiful countryside where most of my favourite places are. So I'm thinking of your question that's going to come out at the end.
Okay, yeah, you're getting prepared for that already. I like that. But are you saying that just because obviously there's some incline and
no, not necessarily that. I mean, I'm a country boy.
Okay.
Being in the city, with tarmac and concrete.
Okay.
Get me out into where you can hear the birds sing.
Yeah, sure.
And all the rest of it.
And it makes running more enjoyable, I think, if the environment around you is bringing you some kind of joy.
Exactly. So, like I say, again, it's fair. Well, I don't know whether it's because I've done it for 30 years, but so it makes it sound, well, to me, it sounds just basic and simple. But yeah, put your running shoes on and just go out for a walk. Do a little bit of a run, go for a walk, and just vary it. I mean, a colleague of mine over in Australia, Simon Bartold, who is a bit of a name, a bit of a legend in the footwear and podiatry world. He says, go out the door and turn left. Don't always go out and turn right.
Okay.
Go out and actually,
mix it up.
Mix it up a bit.
Yeah,
so, again, don't always go out for a long run. Do a shorter run, but at a higher intensity.
Okay.
Put some hills in there. I mean, I used to have a triathlon team here in Portsmouth, and I would always drag them out to Cosham and East Cosham Road.
Okay.
A lovely little incline. They won't say that. It's about 7% incline for about 500 metres, and I would get them to run up and down it for an hour and a half.
Wow.
But they still came back every week.
Yeah.
I'll say just vary it.
Okay. Keep the variety. Keep it interesting for yourself.
Exactly.
And any tips on, like, obviously knees are important and something that you really specialise in. Any tips on how we keep our knees healthy?
Yes, by looking after the muscles that attach to them. So, your quads and your hamstrings. So, if you're a member of a gym, the leg extension machine should be your best friend.
Okay. Don't miss leg day.
Yeah, no, seriously, don't. And again, when I deal with ACL patients, I still get people saying, "Oh, you can't put them on a leg extension machine."
Mm-hmm.
So no, actually we can, and we know again through research and all the rest of it, that's the best thing for them. But if they're not a member of a gym, then they can stand in their living room, do some squats, do some lunges.
Okay. What is the leg extension machine? Is that the one where you push
No, so you're seated
forward?
and you'll lift you've got a bar, a
Okay.
roller across like your shins,
Okay.
and
you lift it up.
you're lifting up
Okay.
that one. And then
So
also
how could you recreate that without the gym? Sorry.
you can if you got a resistance band,
Okay.
then you can put that around your chair,
Okay.
put your leg through it,
And then
again
lift.
then go through it. So again, you don't need to be a member of a gym.
Mm-hmm.
So if you've got a wall in your house, which I'm assuming that most people have got
Mm-hmm.
at least one wall in the house, they can do wall sits, which me of my age, we used to get, every day in PE at school.
Yeah, I remember.
And it was torturous. But it is, again, a very, very good exercise. And it's basic. You sit against the wall and you stay there till you can't, and then you stand up.
Yeah, okay.
You walk around, you put the kettle on, you come back, you do it again. Or say you do some squats in your living room, or you do some lunges, so again, you can do pretty much anything to look after your knees. But like I say, again, without boring you, there is the hamstring to quad ratio,
Okay.
which people that come to see me in my clinic get bored with me talking about.
Right.
But we know that you've got to have a certain percentage of hamstring strength relative to your quads to make sure that your knees are healthy.
Yeah.
But like I say, if you haven't got an expensive dynamometer like I've got in my clinic, squats.
Okay.
Or sit down in the chair, stand up, sit back down in the chair again, stand up, repeat
Okay.
that 20 times.
So it can be quite basic, really.
It can be very basic.
Yeah.
Um,
It's just, I guess, the repetition over time and actually giving putting some thought into how you kind of keep everything strong.
Exactly. Yeah. So like I say, where I'm at the John Pounds, I've got my clinic room, which is, I don't know, 2.5 times the size of the room that we're in at the moment, possibly
Okay.
3 times.
Yeah.
But I'm fortunate enough to have a gym right above me, which
Okay.
is very, very underused.
And I don't think people realise that there is a gym in
No.
John Pounds.
No. And for a community gym, it is brilliant. It's very well, maintained. The equipment in there is of a really good standard. And like I say, you can walk in there sometimes and be the only person in the gym. So again, if you like quietness, or if you like, if you don't like me, who's a major introvert, if you don't like being around people, it's brilliant for you. And you can go in there, do your training session. They've got showers and they've got a change room, so you can go and have a shower, put your clothes back on, and go back out into what you normally do for
Yeah.
your life. That's why I'm there at the John Pounds, because I have a
Okay.
nice clinic room and I've got a gym. And again, exercise is key for just about everything. Exercise and nutrition,
Mm-hmm.
are two fundamentals. Join a gym, look after yourself, eat properly, or come and see me and I will nag you.
Yeah.
And I do nag.
I wonder if there's anyone there might be someone. Well, I was saying to you ahead of this recording, Trevor, that I decided to do. Well, I went to it was like a get back to netball session last night, actually. So it's very timely, this chat. And then I kind of didn't do anything to warm up, it felt like, before I went. And then before I know it, we did some warming up when we were there. And then I played a game. And then I sort of the rain actually came last night, so we had to finish early. But I didn't do any warming down. And I just wonder, I haven't played for maybe 15 years, and I just expected my body to kind of be able to do it. And I wonder if there's anything that I could have done to prepare myself, or post the session. Is there anything I should have done after it?
Controversial, this bit.
Okay.
But yeah, we know that static stretching.
Okay.
Again, again, with me being, I've got a grey beard, so I'm quite old. So back in my youth, we was always told to stretch before we go and do static
Yes,
stretching.
Yeah. Is that a thing?
No.
Okay.
We don't actually get people
Well, that's good to know.
to do a static stretch anymore, because stretching the ligament, the tendons, the muscles actually kind of weakens it. So if you're going to go and stretch your hamstring and then go for a run, we know again through research that you can be slightly slower, or potentially cause an issue.
Okay.
So yeah, dynamic stretching, so standing there holding onto a lamppost, swinging your legs from side to side, backwards and forwards, and all the rest of it. Do something like that rather than just grab hold of your ankle and stretch your quad.
Warming down, is that important, or is that not a thing?
Again, depends on what you're doing.
Okay.
But again, I mean, I work with high level athletes, and sometimes they're just they finish their training session, they sit on the floor with their back up against the wall, get a can of some chemical rubbish like I've got down beside me.
That feels like a big contradiction.
Yeah, but
keep yourself well, but drink energy drinks.
Yeah, yeah, bless them. But no, so again, stretch if you need to, if you want to stretch. But yeah, I mean, like I say, I work with some athletes and they'll just sit down, back against the wall, with a towel, dry themselves down, get up, get in the car, and go home.
Maybe just give yourself a bit of space to
I
before
mean,
the
some
next
people will do
thing.
some stretching, and again, it helps from a psychological point of view. It's like,
Okay.
I've done my train session, I'm now, I've stopped that, so I'm now recovering.
I'm in a wind down
It
kind
can kind of help from that sort of perspective.
Okay. Well, that's good. So I don't feel too guilty that I sort of just did it and then came home and then, had dinner.
I mean, if you woke up this morning and you the front of your thighs, your quads, or your hamstrings were a bit sore, again, that's delayed onset muscle soreness.
Okay.
So maybe next time spend a couple of minutes stretching your quads out.
Sure.
Before you get in the car to drive home.
Okay. Listen to your body. I guess that's your biggest messenger, isn't it, really?
Yes. Yeah.
Okay, I love that. So we spoke a lot about kind of education, and I know you're really passionate about that. Are there any kind of things that you're doing at the moment that you want to shout out, or are there any kind of initiatives or schemes that you have? What's the kind of message that you want to share with people about your work?
What I'm working on at the moment, which is why I've I bugged you guys and Spark and a very nice lady over at Portsmouth City Council who organises lots of different groups, whether it be smoking, weight management, lifestyle management. All I'm trying to do now is, somebody said, they said, Trevor, you're trying to be the male equivalent of Florence Nightingale here in Portsmouth.
Okay.
I'm not sure whether that's accurate or not. But yeah, all I am trying to do is get an initiative going. And again, without getting on the soapbox, the NHS is brilliant. Love the NHS, and we're fortunate enough to have the medical care that we've got.
Yeah.
But like I say, like many places in this country, or many things in this country, it's swamped at the moment. So if I can step in and provide a service for the people of Portsmouth, which is why I thought chatting to Shaping Portsmouth would kind of be, a good way to get my message out. Then because like I say, my aim is to educate people here in Portsmouth, to provide a service, because like I say, people in this country have this idea that the NHS will look after us from cradle to grave. But the waiting times are growing. Again, for an ACL reconstruction here in Portsmouth, it's 11 months.
Okay.
So if you tear your hamstring and completely rupture it, you've got to wait 11 months to see a surgeon and go under the knife.
Okay.
If you're in Southampton, it's 8 months. And Southampton's 20 miles down the road. Why is there 3 months?
Yeah. And I guess, like you say, in that 11 months, it's how you feel, it's the limitations that you face, it's how it impacts your mental well-being.
Exactly.
And I guess you're trying to create something that so people don't have to go through that wait and don't have to then face the like knock-on effects that can have.
Yeah. Again, other facts and figures. 30% of 30% of what GP sees are MSK-related issues.
And what does MSK mean?
Musculoskeletal.
Okay.
So like I say, you get 8 to 10 minutes with a GP, and this is not me knocking GPs. Some very good friends of mine are GPs, and I think they are brilliant. But again, they are swamped.
Yeah.
And you get 8 minutes with a GP who's got to diagnose, treat, and put a plan in place for you.
Yeah.
Well, people come and see me for an hour,
Yeah.
which normally turns into an hour and a half because I talk a lot. You might have noticed. So, again, if they can come and see me, and I say, working with Portsmouth City Council to get this initiative going. There's another company in Hilsey. Had a chat with them yesterday, so I don't know whether I'm allowed to say their names or whatever. But there's a care. There's a company in Hilsey that sends carers out to people who need the help. So again, I'll be going in, teaching their staff about how to do basic exercises at home, how to educate them about what's right and what's wrong, what's no longer.
Yeah, sure.
Keep
the knowledge up to date. That's such a great place to start, isn't it?
So I haven't got a charity event, but I've got an initiative to help people at Portsmouth. I'm not from Portsmouth. I was born in Chatham. Come down to being a snob, it was a Fareham Gosport border, place called Pill Common.
Okay, yeah.
We had a Gosport address, but a Fareham telephone number.
Okay.
So it was Fareham. Sorry, you're from Gosport, aren't you?
Yes, I am.
Sorry. But then, being in a naval family, we moved around a bit.
Yeah. Is Portsmouth your home now, would you say?
Portsmouth is my home now.
Yeah.
And
okay.
I am passionate about Portsmouth.
Yeah.
Which is why I really want to help the people of Portsmouth.
I love that. And how can people find you, Trevor, if they're interested in your work or they have any of their own kind of niggles or anything they want to talk to you about? What's the best place?
The best place would probably be Instagram.
Okay.
So again, athletic performance therapy.
Yeah.
All one word.
Sure.
Find me on that. I'm on Facebook, but I don't know the terms, and my own personal homepage on Facebook is now basically my work one.
Okay.
Because I don't share, family photos or
Sure.
what I had to eat on Facebook. It's all about
no pictures of your dinner.
No, or my children or anything like
Okay.
that. So I put papers up that I've read, papers that I think are relevant to
Sure.
what people
Information
need.
sharing.
So find me on Facebook. It's just Trevor Payne.
Okay.
Instagram, athletic performance therapy.
Great.
And LinkedIn, again, just Trevor Payne. You can find me on them. I'm not
Amazing.
on Twitter or X.
Well, it's good that people know how to look you up if they need to, or reaching out to us here at Shaping and we can connect you. That's not a problem. You alluded to it earlier, and I know you've been thinking about it, but we always end the podcast with your favourite place in the city in Portsmouth. So, like I said, it could be a restaurant tip, it could be a place you visit, it could be a view that you love.
A restaurant tip would be Viet Quorn.
Okay,
which
yes.
is literally
just round the corner from where we are. Yeah,
that way.
Yeah. Hampshire Terrace.
Yeah.
Yes, that is a great restaurant
it's
tip.
a great restaurant.
Always a really great meal, really reasonable, really fresh, really delicious. I love that. I've been there a few times.
Yeah, no, I love it there. So that's a restaurant tip. I don't drink, so I don't know really. I haven't got a favourite bar, although I'm off out tonight with Clare Martin's husband.
Okay.
And he's going to try and ply me with alcohol.
Right.
But a favourite place in Portsmouth. I haven't been there for a while, but I always used to like going down to the seafront.
Okay.
So I haven't been to the seafront
Okay.
since they've done all the changes down there. So
There's lots to see.
yeah, so I should really go and sit down on the bench again and look out
I mean, it's really impressive, actually, everything they've done. It makes you so proud of the city. It looks really beautiful. So I definitely recommend that you.
Yep. Actually, I've actually just
head
thought
down
of the
there.
place. It's on Milton, not Milton Common, along the Eastern Road,
Okay.
where you have the walk from the pub going up the Eastern Road.
Yeah.
And you get to the top, there's the Armed Forces little memorial place
Yep.
there, where it's got the flags of the RAF,
Okay.
the Navy,
Yes. Yeah.
and it's got the white dovecot
Oh,
place there, the
okay.
benches
Yeah.
there. 'Cause again,
Right. That's
Yeah,
a
if we need-
great view.
so yeah, if we want a time to reflect and be
Yeah.
peaceful, there.
Okay, well, that's a great tip and one I don't think anyone's mentioned before. So thank you for that. It's been so great to chat to you, Trevor, and learn more about what you do. And yeah, if anyone wants to be connected to Trevor or, any questions about their own needs,
Yep.
then Trevor's your guy.
Thank you.
Thank you.
This podcast was brought to you by Shaping Portsmouth, working to make Portsmouth the #1 UK city in which to invest, live, learn, work and visit. To find out more, please visit shapingportsmouth.co.uk. This podcast was supported by Spark Community Space and Portsmouth Community Lottery.